proposed Senate Bill 351, a bill that essentially expands the scope of practice of nurse practitioners. They are not required to complete mandatory standardized continuing medical education that is needed to bring modern care protocols to everyday clinical practice.
Nurse practitioners are required to have board certification and maintain certification in an ongoing perspective. And each certification board has different requirements. The cycle may be 3 years or 5 years, but there are continuing education requirements, there are practice requirements, and there are, for women's health and neonatal nurse practitioners, we have to retake an exam every 3 years to maintain that board certification.
The last thing that every single APRN in this state has accomplished is they are nationally certified, and they vary widely based on their particular specialty, but these are national exams. They are normed. They are pushing the envelope at all times. We're raising the bar on our education every single year.
There are only 9 counties without a physician and only 15 counties without a family physician. That is less than 10%.
I'm from Valdosta, Georgia. People with diabetes already have enough to worry about. They do without food to buy their insulin. Some of them have to drive and take their children over here to Macon because there's a 2-year waiting list to be seen by the endocrinologist.
Practice that APRNs actually do not move to rural and underserved communities, but continue practicing and serving in urban areas.
They're actually, when you look at demographics, APRNs are 2 times more likely to be in rural settings versus in underserved areas of urban settings versus our physician colleagues.
I open my practice to serve my community. That's what we're here to do right here today. We're here to let our community as a group know that we are needed. So that being said, I have 750 in my practice, and I've been open for less than a year. I see 20. I've been open less than a year.
And you have how many patients?
750. And I'm opening a second clinic on Saturdays starting this Saturday.
Finally, this bill has the potential to add to the existing problem of overutilization of scarce healthcare resources and increasing costs is the potential for overprescribing of medications such as antibiotics and controlled substances that could worsen the opioid crisis in our state.
Advanced practice nurses, we did not cause the opioid problem, but we are ready to help fix it, and we can if given this opportunity.
This concept, as presented in this bill, will not alleviate the problem our state has with access to care in rural and underserved communities, and in fact, may add to the current crisis that our state and indeed our nation is facing in fighting this opioid epidemic.
People need care. People are suffering. Advanced practice nurses can be a solution alongside doctors. I happen to practice in another state, in a clinic run by advanced practice nurses, and I can tell you, when we are compared to a lot of other practices that are run by physicians or anybody else, my specialty is anticoagulation. We have won multiple awards for being centers of excellence, for having the highest rates of time within range when it comes to anticoagulation. To say that advanced practice nurses will not alleviate the suffering that's happening in the rural areas is even shameful enough to say.
First, do you know what percentage of the family physicians are registered with the PDMP?
No, ma'am, I do not.
Do you know what percentage of your group works in rural Georgia?
As I mentioned, I work at Emory, and we are in Atlanta only.
Right now, nurse practitioners have the ability to practice in rural areas if they choose to do so. They just don't.
I already have 2 other nurse practitioners that want to come and work with a practice that I only opened 4 weeks ago, and I'm already averaging 20 to 25 patients a day because they can't get into the other physicians' offices. And if they do, they have to sit and wait for hours and hours and then get turned away at the end of the day. We also want to invite the physicians in this room. Me personally, I could have stayed in Augusta or in Athens and made lots of money, but I want you to come to Wilkes County, Tolliver, or Lincoln and work with me. See what we see.
I'm concerned about a two-tiered health system, one in which urban residents and rural residents have completely different levels of care.
I love Thomaston, Georgia, and the women who are there, who, by the way, are dying in childbirth. Our state is 48th in maternal mortality. That's the most recent number. They are really asking for midwives, and midwives have great outcomes, and we can make a difference in those areas, but not if students aren't able to stay here and work. And what will really attract good workforce, keep students here that we're training, and in fact attract them from other places is great policy. And I think that that's what we have here with SB 351.
There are NP programs that are 100% online with nearly 100% acceptance rates, many of which require no prior RN experience at all.
We do offer online education, and I know that's an issue for many people. We find that online education is superior to standing in front of a group and lecturing, because with online education, we can teach state-of-the-art at any moment. The student is an active learner. They're looking it up. We're not spoon-feeding them, and we find this is superior.
And they require as little as 500 clinical hours of experience for graduation.
But overall, if you look at the specialties and degrees, you would think 800 hours plus rather than minus. In addition to the BSN, and in addition to the fact that most do practice all the way through their program. Even if they move straight from the BSN to the APRN, they're practicing as a nurse. That's why they do so well in our programs. They're very current, and they know what's going on in more than their education.
Backwards. The nurses like to claim they provide a less expensive alternative to health care. I'm not sure how that's true if they're ordering more tests, making more unnecessary referrals, and ordering more medications than primary care physicians.
In regards to the information presented about radiologic testing and nurse practitioners ordering more, that would probably be true because so many of us work in acute care settings. If you lump all of us together and compare us to family physicians on an outpatient basis, that data would look skewed for sure.
Started seeing a massive number of increased referrals that I would classify as inappropriate and even oftentimes grossly mismanaged.
Stories or studies that talk about not being prepared or advanced practice nurses not being able to give quality care. But there is a significant amount of studies, of research, evidence base that shows that advanced practice nurses across the board are delivering safe and quality care. I'm not here to talk about nurses and doctors, who's better, who's not better. I'm here to talk on behalf of the great citizens of our state that deserve health care.
Not my issue. My issue is when I see patients that have been seen for 10, 12, 14 months, they don't understand that they haven't been seeing a physician.
Well, nobody's trying to say that we're not physicians. I never tell my patients I'm a physician. I always correct them when they call me doctor.
It was 600 supervised clinical hours, which simply meant they followed along behind me and watched what I did. That's 3 months of a 40-hour work week, and they're released to be a full authorized practitioner of care.
And then also, the physicians that allow the students to just follow did those students an injustice. Those students should have been working, doing what we're trained to do as nurses: assess patients, manage their care, and educate those patients. For any physician that allowed a patient or a student to come and just follow you, that's an injustice. That's wrong.
We do expect every student to progress. We're monitoring how many pap smears they've done. We are monitoring this kind of activity. And if that clinical practice does not allow the student to learn, then we take them out as quickly as we realize that.
Having someone less trained to manage these children without the benefit of linkages and connection and supervision to other physicians.
There is a significant amount of research that shows that advanced practice nurses are able to handle at least 80% of cases that walk through the door in any primary care setting. Do we say that we don't give physicians what they need, which is more education, which is more dollars to be able to expand telehealth? I'm all for that. And I'm sure everyone in this room would be. But it is not a reason to deny people care when you have a workforce that is willing and able and ready to give it.
There is no need to grant independent practice to nurse anesthetists in this state. Patients will not benefit from the independent practice of nurse anesthetists.
When I began working in Wilkes County in 1992, there were 8 physicians and 2 physician assistants. Today, we have 3 physicians in Wilkes County, and one of them that's admitted into the hospital, and one of them is actually in a neighboring county and is the only family certified physician. We have a critical access hospital that is about to close. They have enough money to last about 3 more months.
What hospital is that?
Wills Memorial Hospital in Washington, Georgia. As you all know, many factors come into play for the rural hospitals in Georgia, and with the passage of Senate Bill 351 allowing nurse practitioners greater allowances and greater access to providing better care, we'll have the means to maybe keep that hospital open.
I'm not here to talk about nurses and doctors, who's better, who's not better. I'm here to talk on behalf of the great citizens of our state that deserve health care. There are people who need health care. And if it is one more advanced practice nurse that can go into a rural area and stop a life from being stuffed out, stop a woman from bleeding out after delivering, stop a woman from having to drive 80 to 100 miles to get women's health care, is that not worth it? There are about, 25,000 doctors? Even if you got rid of all of us, you would not be able to see all of the patients who deserve care in this state. There are 13,000 approximately advanced practice nurses. If we combined together and we were able to give the care that the citizens needed, wouldn't we all be better for it? We can do it. And I know that it can be done here. And the people here deserve it. To reduce it to dollars and cents and saying one group is not going to make money and another group, the community, I'm sure, wouldn't want to hear this. If we went outside and we took this out to the community, what would they say? So if that is the case, and we can provide that in a rural area, why not? Why not? And so therefore, I implore you today, let's work together. Advanced practice nurses are willing and able. Thank you.